IV sedation, a synonymous term is conscious sedation. The name implies conscious. You're still awake. You still have all your protective reflexes. The difference is you're in kind of this like deep trance state. Some people will drift in and out of sleep with that, but it's not the same as general anesthesia. Another common thing is, people say, well, I want to be knocked out, right? I don't want to remember anything of this procedure, which totally understand that. I mean, you're going to the dentist, you're getting a lot of work done. So the conscious sedation, for all intensive purposes, it accomplishes that because you are sedated, you kind of drift in and out of sleep. And also the drugs have amnesic effect. So you actually feel like you were asleep the whole time and won't remember anything in the procedure, which when we're doing dentistry, that's a great way to go. So if you've never experienced sedation before, if you can kind of think to that dream state you're in when you're sleeping, that's what IV sedation is like. That's what conscious sedation is like. We use conscious sedation for wisdom teeth removal. We use it for colonoscopies, like other outpatient medical procedures, it's a very common thing. So most people have had some form of conscious sedation. Sometimes they just don't even realize that they have. It's going to be when you're in kind of that deep dream state. A lot of my procedures are, 3, 4 hours long. We're doing a full smile makeover, a full mouth reconstruction. When we get to the end, I'm tapering the sedation off. So by the time we're done, they're completely awake. And a lot of times they'll say, hey, what time is it? And they'll tell them, it's 12 o'clock and we start at 7, for example. And I'm like, how is that even possible? Like, it just felt like that, right? So it is, it's kind of a time warp. Like, they don't realize that so much time has gone by because they're just really comfortable, relaxed state. Laughing gas is like the minimal amount of sedation, right? You know exactly what's going on still. You're aware of everything, but you just care a little bit less. Next step up from that would be laughing gas combined with an oral sedative like a Valium or a Xanax. Everybody responds differently to the medication when you take it orally, and it takes about half an hour to an hour to start working. So if you take the pill, we're starting to work, and it's not enough, it's too late. There's really nothing you can do about it. Whereas if we have an IV in place, we're using similar medications, but we can, the term is titrate. We can control the dosing right away. So if someone doesn't have enough sedation, we give another dose and there's immediate impact. And so it gives ultimate control to really provide the best experience possible. I was really well trained with IV sedation, and I also helped teach the course for IV sedation training. And so we take the monitoring part very seriously. So we go above and beyond what's even required by the state. Hospital grade monitoring, hospital grade equipment. We have every vital sign monitored, including something called expired CO2. So we're even monitoring the air coming out of your body to make sure you're exactly where we want you to be and you're completely safe.